Welcome students. So this video brings us to talking about the integumentary system, better known as your skin, your hair, your nails, and the glands that affect your body in the integumentary system. So if you look at that word, the word integument, okay, literally means a covering, okay? Even though that we think of just that definition, the skin has a lot more functions than just this covering to protect the body. So it does reflect the health of us, and it also can reflect the emotional state. Okay, so definitely think about when you're thinking about when you're stressed out, what your skin looks like, okay, and the parts that come. So definitely know what is inside the integumentary system. It's composed of two parts. Okay, we're going to look at the skin and the accessory structures. So the skin has three different layers. We have the epidermis, the dermis, and the subcutaneous, or also known as the hypodermis. So let's look at the epidermis. Okay, so the epidermis itself is going to be that upper layer itself. The upper layer is definitely going to be the epidermis. Now, as you're learning these three layers of the skin, definitely be thinking about the functions of the whole system of the integumentary. So beyond just your skin, the epidermis, and then we'll look at the dermis and the subcutaneous, think about what those areas are going to be doing for us. So as a whole, the integumentary system is about protecting you, regulating you, and collecting information. Okay, so definitely be thinking about those functions. Okay, some other things that will especially happen, we talk about the epidermis especially, is absorption, okay, especially of like patches, medication, okay, the excretion of liquids such as sweat and oil, but the epidermis also is going to play a role when we think about things such as manufacturing certain vitamins, such as vitamin D, okay, and then helping to synthesize that within our body. Okay, supporting, protecting. Okay, it's the outermost cells that are continuously wearing down, and you're shedding them throughout the day. Now, go back and think about when we talked about the word of avascular. Okay, so avascular is Manee. Says you thought I forgot about Manee. Manee's like, you have not forgotten me. Okay, I'm an avascular creature, because I am a stuffed animal, okay? But in the real world, a manatee is not avascular. A true alive manatee is going to be what? Vascular, okay? So your skin is like this stuffed animal, okay, of avascular, okay? So I'm not going to Manee, but if I was to cut Manee open, I know that terrifies him. Obviously, stuffing would just come out, and he's not going to bleed, okay? But in a real manatee, please do not do that. I feel sorry for the poor manatees that you see. That's where you save the manatees is so important when you're boating, because you see so many of them, unfortunately, with scars in their bodies from the propellers from the boats that have hit them. So they do bleed. Okay, real manatee is definitely going to bleed, just like any animal, okay, itself. But so when you think about the epidermis, it's the most superficial of our three layers, okay, of our skin, our integumentary system. But we're also going to look at how deep do we have to go once we get past the surface for there to be some bleeding, okay? Because the bottom layer of the epidermis is going to be nourished by capillaries right before we get to the dermal layer. So there are two layers within the epidermis, okay? So the top layer is going to, and you're going to, of course, see here in a little bit a video to kind of demonstrate this to you, okay? So that way it would definitely hopefully help you to visualize it. But you're going to see, of course, the epidermis, and within the epidermis, there are some multiple layers. Most textbooks just talk about two of them, the two of the stratums. Okay, so depending upon, of course, I'm using this textbook, it's going to call them either the germinativia or the basal or basal layer. Okay, the baby's in the basement. I know that sounds weird, but I'll come back to it. And the corneum, which is the top layer. So think about if you had a corn, it's going to be on the surface. Okay, so again, use hopefully after I get through this and you watch that little section of a diagram to help you to definitely visualize what it is going to look like. So epidermis, stratum, corneum's at the top, okay? It's going to be the layer that is going to be definitely coated in a keratin base. Okay, keratin is going to be waterproofing. Okay, it's a protein. Okay, so keratin strengthens and protects the skin. Okay, it makes it thicker. Okay, within it. So definitely that top layer is protective, and it's more prominent, definitely in thicker skin than it is in thinner skin. And the cells on the surface are constantly being exfoliated and lost. Okay, so definitely important to think about. This is the area of the corneum, is this stratum of my epidermis that I'm exfoliating, and I'm constantly losing. Now that deeper layer, the germativium, okay, the babies in the basement, it's like, what do you mean? Babies being, those are the cells that are directly touching the blood supply, the lowest layer of our epidermis. We're getting deeper now, right before the dermal. The dermis is the next. This is where new life is beginning. Okay, the babies, okay, are being made. The new cells, mitosis is happening in that basal layer, and that germativium is constantly dividing and producing new cells. Now, as those babies age, they're going to move up, start going through basically kind of a coating of this keratin, and then they're eventually, of course, going to get far enough away from the blood supply that they're going to die, and eventually we're going to shed them off. Okay, so also kind of go back and think about tissue chapter that we're talking about stratified. Okay, remember stratified, the stacking of George, okay, and Manee. Stratified means multi. Remember squamous, okay, flattened, okay, cells of epithelial. Okay, so kind of hopefully you're still using those names. It's very important to also know. Now, one thing I want to point out before I move on to the dermis, within this layer, some of those cells in the basal layer, or the germativium, whatever you want to call it, produces melanin. Okay, so melanin is a dark pigment that colors our skin, okay, a dark pigment, and protects it from the UV lights. So there are special cells called melanocytes that live within that area that helps to give us our skin color. Okay, so everybody has that dark pigment, okay, scattered throughout the skin. But again, we think about if we have irregular little patches, such as I have a lot of freckles. Okay, so those are melanocytes in that area that have kind of overworked more than the skin as a whole. Okay, so if you have darker skin color, then obviously your melanocytes, you have a lot more of them that are working a lot more. Okay, so we think about conditions such as if I'm having areas that has no skin color, okay, white, I mean we're talking about white, like paper, piece of paper white, then that's going to tell me, okay, the melanocytes either don't exist or they're not doing their job, okay, itself. So we all have a pigment, a darker pigment, that happens within that dermal. Okay, right before you get to the dermis, the next layer, right above that in the epidermis, okay, that's where those cells are going to live. Now the next layer is what we technically can call the true skin, because this is where our blood vessels live, very vascular, okay, is the dermis or dermal layer. So epidermis you touch, you got to go down to where you literally get a deep paper cut and you start to bleed. That's where you probably have hit the dermis. Now the dermis again has some dense, irregular connective tissue. So remember, kind of we're talking about the more of the getting close to jello, okay, as far as it being set up. Okay, there's lots of blood vessels here, there's nerves, and it is the true skin because most of the skin's vital functions happen in the middle. Okay, the middle, and again, use the little video that you're going to see, or diagram here in a few minutes. Now because it's very elastic within this area, that's where the skin can stretch. Okay, we think about it especially like during pregnancy, obviously in certain areas with little damage itself. Now right below that, we'll get to it here in a minute, will be the subcutaneous. Now the dermis, okay, extends upwards into the epidermis, okay, allows again the capillaries to touch the epidermis. We think of your fingerprints, okay, that actually is in the dermis layer, like mountains pushing up through the skin. Okay, so your fingerprints happen in the dermal layer. They're very deeper, okay, they just push through the epidermis layer. So we're kind of again like mountains kind of pushing up, or an iceberg pushing up through the water, and so it helps us to grasp, okay, also to that thickness of our skin with it. Now things you're going to find within this layer are going to be hair follicles, different glands such as oil glands and sweat, Okay, we'll look at those here in a minute, better known as sebaceous and sudoriferous. Your sensatory receptors, okay, and again, more than just on the surface. So when we feel things as far as pressure and something soft versus rough. And of course, I already mentioned earlier your blood vessels and your nerves. Again, this is protection still within this area, but also nourishment because of the veins. Now, the last layer, the deepest layer, is going to be the subcutaneous. So subcutaneous, again, is the lowest level. Sometimes it's called the hypodermis. It's going to be also sometimes called the superficial fascia. So it's the fascia right before we get to, of course, the muscles and the bone. This layer, again, is going to contain underlining muscles. So this area contains the areolar connective tissue and fat, better known as loose adipose tissue, okay, within this area. So when you're looking and think about, maybe labeling, drawing pictures, obviously, using different types of mediums to help me know what's on the different layers. This is where you're going to see lots of adipose tissue. Okay? It's going to help to anchor the skin above it in place itself. So that's why fat, it's an insulator. It also helps to prevent extreme temperature changes, so it helps with homeostasis. And it's got a lot of energy supply because of the fat. Okay, so continuous bundles are going to be, and again, sometimes there's not really a clear boundary sometimes between the dermis and the subcutaneous because of that. And again, the blood supplies that supply the skin and nutrients run through this area, and also you will have some nerve endings. Okay, so the thickness and thinness of it just depends on, of course, obviously the different areas throughout our body will vary. Well, hello students, here is a good example to use, and again you can use a variety of things to help you to know the parts of the integumentary system. So what I've got here is some different types of sands that you're going to see across here. Okay, I kind of picked different colors. Again, you can use whatever medium that you would like to use, and then the container right here is going to represent our skin in the different layers. Now I've went ahead and put a couple things as far as the accessory glands and accessory structures to help you to visualize this as you're learning the different layers. Now I'm going to start with this one here, and we're going to start from the bottom and we're going to work our way up with this. So already in here, and I kind of bring it a little bit so you can kind of see a little bit more, is I've put a pink, again, like a pipe cleaner in there to represent the nerves, okay, because you definitely need to make sure that you're representing the nerves. And then this piece here, okay, that you're going to see is going to be the hair shaft, okay, coming out of the top layer. Okay, then you notice it goes deep inside, and then you see a yellow and an orange. Those are going to represent two types of glands that we're going to look at. So let me put this back here so you can see it. So let's start with the subcutaneous or hypodermis level. So again, just get you a spoonful, and again, I'm not going to be probably the neatest with this, just to kind of cover it up there, but we'll do a little bit, because this is kind of a deeper layer that you're going to see. And it's kind of cool if you can get do sand art and stuff like that. Kind of leave it so you can kind of see again some of these other structures that are in there. So the bottom layer is going to make, again, the adipose tissue. Okay, so it's going to connect, and it's going to hold everything above it in place, but also this layer, subcutaneous, or the hypodermis as it also is called, is going to anchor things in place. Okay, so that's the lowest level in your 3 layers of your integumentary system. Now the next layer is the most important, and I kind of kept it like pure, almost pure like sand. We'll put a pretty good amount of this in here. Unfortunately, I know I'm going to cover up a couple of the glands by doing this. But you got to know within this layer is going to find, this is going to be, and again, you have the lowest layer, and the next layer is the dermal layer. Okay, and then the dermal layer is going to have all of those different type of accessory structures. Okay, so in the bottom, yes, you saw earlier the nerves run into, but they actually will be in the dermis, the dermal layer. So you got nerves, you got blood vessels. Okay, so you can maybe add another pipe cleaner to kind of visualize that. Then you have, of course, your hair. Okay, the follicle region would start with the blood supply down here. So this layer is very vascular. Okay, it's avascular as far as the top, but it's very vascular in the dermis region for a reason. Okay, because that's where the blood vessels live. So if you cut your skin and you start to bleed, that's the level that the blood is coming from. So a couple different, again, I'm going to kind of pull it out here a little bit because I don't want to miss seeing our lovely glands. Okay, so a couple different glands, remember, within this area. So as you're learning them, okay, in the chapter, and of course you're going to hear about it towards the end of this video. So we've got 3 different type of glands we're going to talk about. 2 of them I put on the hair follicle for a reason. Okay, we have one that's called the sebaceous. Okay, and the sebaceous is going to connect up to a hair follicle. Okay, and it's going to, of course, come out through the shaft. The sebum comes out of this. So again, sebum, when we learn about it, is going to be oil. Okay, but it's connected to the, again, the hair. The other gland that you see here is one of your 2 different types of sudoriferous. Okay, now sudoriferous means sweat. Okay, so one's attached to a hair follicle. Okay, and it's going to go, of course, the shaft, and this is the one that becomes active. Okay, you'll hear me call it AP for short. Okay, apocrine, okay, sweat gland. Sudoriferous also is the medical term. That's going to, anytime you're active during puberty and the hairs start to grow, you're going to have a sweat gland, and sweat's going to go up that. So you have 2 of your 3 glands. One is oil, one is sweat, associated with hair. Okay, the 3rd type, and I'll just throw it in there, is the blue one. Okay, kind of put it up for the front so you can kind of see it. The 3rd type, and this is the 2nd type of sudoriferous sweat gland, is going to be the eccrine gland. And this one is not attached to a hair. So they're just, again, holes in your skin. You have a lot of these, the most numerous. These are going to help to cool your body down. So when you kind of think of sweat, you kind of think of this one, it's more kind of salty, but this one has more, again, of a smell to it because it is more active during puberty. So know the 3 different are all associated in your dermal layer, okay, in your dermis itself. Now the epidermis would be the last type. Okay, now I did 3 different colors for a reason. You might do the bottom one as red. I kind of like this teal color, so we're going to pour it on top of all of this goodness. We'll kind of shove the glands down in here because this needs to be on top. And again, you can use whatever medium you want, but I kind of like to see it. Maybe you have to get a little bit more there to cover it up properly here. So the next layer, okay, hypodermis, dermis, and the first beginning layer, again, we're talking about deeper, called the stratum germinativum, or stratum, also be called the basal or basal layer. Okay, and I call it the babies in the basement. So again, as they age, they're going to go to the surface, get further away from the blood supply, and then we eventually shed them off. And it's crazy how much dandruff that we leave behind itself. So definitely know that the lowest level, the stratum, is an epidermis layer. Okay, it's just the deeper one. Then you go to the next stratum. Now you have more stratums than most books talk about. Okay, so most books just have kind of the 2. The next stratum that you're going to be is the top, the corneum. Okay, so think about if you have a corn in your skin, it's on the surface of your skin. So 2 different stratums. Now you could use kind of that last color just to remind you that all of that top layer, okay, and I'll kind of pour it in here so you can kind of see it. All that top layer is going to be your epidermis, okay, the epidermis. So I kind of put a couple of those different colors. I'll turn it just a little bit so you can see it. So bottom layer, hypodermis, subcutaneous, made of adipose tissue. Next layer is your dermal. Okay, your dermis has all those accessory structures. Then you have 2 of the epidermis. Okay, so stratums. Okay, the bottom one is the germinativum or the basal layer. The next one is the corn layer of this epidermal layer. Okay, and epidermis, remember, is going to be avascular. So again, have a little fun. Maybe make you some sand art, get you a little container to make things in. Or I've had students before that have made like a parfait. Okay, so you could do, you know, some chocolate, you know, maybe do some Oreo cookies if you like chocolate, and then maybe do a layer of just the chocolate. Maybe make some light and dark chocolate so you can kind of see the differences, and then whipped cream on the top. Okay, remember there's only 3 main layers. Okay, I kind of separated the epidermis because you definitely need to know there are many multiple layers. Okay, not just one. one, stratums are only associated with the epidermis itself. So again, definitely know those glands as you're learning them in the chapter. Again, 3 different types of glands. We have nerves that live in this dermal. Okay, we also have, of course, blood vessels, and of course we'll learn about the blood vessels when we get into future chapters. So hopefully that helps you. Now that we've talked about epidermis, dermis, and subcutaneous, now let's talk about the other part of the integumentary system, which is the glands. Okay, now the glands we're going to be talking about are 2 different types, sebaceous and sudoriferous. So let's look at sebaceous first, which literally means oil. Okay, so oil glands. Okay, so remember, these are still going to do a lot of that thing for protection, but also serves to cool down the body. Okay, lubricate. Okay, protection also will come through secretions. So the word sebaceous, they're little glands, little sacs, okay, in their structure, and they secrete an oil called sebum. It always helps to remember the difference between sebaceous versus sudoriferous. A sebum, I think of a bum, okay, laying on the sea, at the sea, putting oil on themselves to get a good tan. Okay, so sebum is the name of oil, but it's the medical name associated with sebum. It helps to lubricates the skin, but also prevents the skin from drying out. Okay, so there's ducts, okay, a duct system of these oil glands. Okay, so think about, of course, conditions we'll look at the end of this video. We talk about, of course, things like acne and stuff like that. Now, the next type of gland is going to be called sweat glands. Okay, so sebaceous secretes sebum, okay, which is oil. That's important. You definitely need to know that. The second type of gland that we're talking about in the integumentary system, sudoriferous, aka sweat glands, can then be classified under 2 different parts. Okay, number 1 would be the ek, okay, eccrine, okay, ek or ek, whatever way you want to say it. Sweat glands, okay, still sudoriferous, it's just a little subcategory. We'll look at where they're at here in a minute. The other one is apocrine. Okay, I always do the AP for a reason, because they're active during puberty. Okay, so the ek, okay, those are the most widely distributed throughout our body, sweat glands. Those are what we really consider to be sweat, okay, when you're sweating throughout the body. Okay, you're going to find them in the body surfaces. They help with temperature regulation. The AP, apocrine, okay, sweat glands, still sudoriferous, are active during puberty. Okay, so think of armpits, groin area. Okay, think about attaching to a hair follicle. So think about when you're active during puberty, that you get hair growing in places that you didn't have before puberty, and on that hair follicle, you're going to have sweat that will come off of that. Okay, that's important to definitely be thinking about. You got to know the differences between them. Okay, now there are some modified sweat glands we'll get into future classes. First one of the ceruminous glands, okay, or serum. That is earwax. Okay, we'll get into again when we talk about senses in future videos. And then there's ones we think about on our eyelids. Okay, they're going to help with some lubrication in our eyes. Okay, and then lastly, the mammary glands in the breast. Okay, so again, some different types of sweat glands you'll also see, but the 2 mains in the integumentary system that we need to focus on, again, are sudoriferous, and the 2 different categories, and sebums. Now the last 2 type of accessory parts, structures within this chapter is going to be your hair and your nails. Now I'm not going to spend a lot of time talking about both of those, okay, because this is not a cosmetology type of information I'm giving you, but the basics of that, we think about hair, definitely there is some parts you definitely want to be familiar with when you're thinking of hair. So again, the hair follicle, again, that little bulb, okay, again, the hair is going to come out through the shaft, okay, again, the shaft is the part that comes out we feel, okay, so the follicle is more deeper, but there is a part to most hair follicles is an involuntary muscle, okay, so think about when we are frightened and we're scared, and the hair stands straight up and you get goosebumps, okay, sometimes chicken skin is it also going to be called. That is an involuntary muscle called an erector pili muscle, okay, literally means hair raising, okay, it's a response the response is not important so much in humans, but it is a warning sign in certain animals. Okay, think of a cat when their hair stands all the way up. Okay, I don't think manatees per se have that ability. The nails, again, I'm not getting into the different parts per se, but definitely know, of course, when you're looking at the nails, of how important our nails are showing us the health. Definitely know that new skin development is constantly happening in that matrix area, located at the proximal. Okay, so remember, proximal is closer this way, end. Okay, what we call the root. Okay, remember when you kind of cut your nails and you get to that nail root and how painful sometimes it can be. Again, the collar of the dermis below the nail bed can be seen. Okay, and of course that helps us to tell if there's some type of pathogen. Especially chronic diseases, if the nail is getting very thin or we're getting ridges and stuff in it, it definitely is a sign to tell us what's happening with the body. Now this part we're going to get into looking at the skin itself. Okay, I mentioned this with the epidermis earlier with skin coloring. So again, there's two different type of pigments that everybody has. Okay, so the first pigment, I already mentioned, the melanin, is the skin's main type of. Okay, so again, it's produced by the melanocytes in that stratum dermatibia region, the babies in the basement region. Okay, also when we think about that, again, think about diseases that could happen. Okay, so when you're thinking about that particular pigment, again, think of a darker pigment. Okay, a darker pigment. Now don't confuse it with the other type of problem, okay, that you can have in your body. When we think about an area that's getting darker, when we think about tumors and discoloration of the skin. Okay, so more of a physiological change. Okay, so when you're thinking about melatonin, thinking about melanocytes, think about like the browning, okay, because it is a darker pigment that makes more kind of a brownish color to it. Now, other colors you could have that you could see within the skin would be things like hemoglobins. Okay, now hemoglobin is the pigment that gives red blood cells that red color. Okay, so it could cause more of a flushing type of look, where that is more diffusing of that redness because the blood is increased. A pallor type, which is that paleness of the skin, can kind of obviously reduce the blood flow. So that's not a pigment, that's just a change in homeostasis of where the hemoglobins is located in that region in that particular time itself. Now, the second type of pigment that we have besides the melanin is keratine. Okay, keratine, or tin, okay, if you want to pronounce it, tinine, is a skin pigment that when we think of carrots, okay, that orange kind of yellow tint, okay, with it. So everybody has that color, that extra yellowish tint, okay, but usually the melanocytes, that secretion of the melanin is going to kind of offset. Usually we don't see it as much unless you're of a certain nationality, especially Asian descent. Okay, when you think about nationalities, usually you see it a little bit more than you would see in other cultures. Now, don't over confuse that yellowing with jaundice. Okay, jaundice is associated with pigment that comes from bile. Okay, so again, a yellowish skin discoloration could be caused by excess bile pigments, okay, from bilirubin, and we'll get into that part in future videos, but we think of jaundice. Okay, so jaundice, if you have too much overbuilding of these pigments, of the bilirubins being laid down, that comes from excessive, a lot of times, red blood cells that are being destroyed or dying in high numbers can cause that level, or our liver is not working. So jaundice would be the name medically for that. Okay, so don't confuse it with the pigment itself. Now, the last part of this chapter I get into is the disorders. Okay, so this is kind of, again, the week that I will start in my videos with you all, going forward to future videos of talking about the disorders that affect the various organ systems. Okay, so this is, remember, this was the very first organ system where we took a whole bunch of different organs and we put them together for a purpose. So the first one are lesions. Okay, so a lesion is any wound or local damage to the tissue. Okay, so again, a cut, okay, it could be superficial, could be deep. We think about a rash, okay, that could be more of a surface. We think about, a pimple could also fall under that. Okay, ulcers, obviously, if we're going deeper, paper cuts, all of that would be a lesion. Okay, so definitely think about more superficial surface versus a deeper lesion. Okay, the deeper the skin is, that's usually where there's more trauma that is caused to the area. Or even pressure, like a pressure ulcer, is a deeper type of lesion. Now, the second type of disorder that you'll see are burns. Okay, now burns, of course, can be very superficial on the skin. Okay, and then they can go down a little bit past the epidermis, then into the dermal. Then they go from the dermal layer to the subcutaneous. And then if they go from the subcutaneous to the muscles and bone, we think then of first degree, second degree, and third. Okay, so sometimes they call them thickness. Okay, so again, superficial would be superficial. Think of like sunburn. Okay, so obviously you can go pretty quickly from a mild sunburn to sun poisoning. Okay, so superficial again involves just the epidermis, just the surface. You get into superficial partial thickness from first degree to second degree. That's where you're getting into parts of the dermis, so maybe the very top of the dermis. Second degree then goes even deeper, and third degree, even fourth degree in some textbooks, get into that full thickness. Okay, and again, that's very, very dangerous. So beyond just from superficial to deep, burns are classified. Burns then also classify the amount of areas involved. Okay, and that's what we call the rules of 9. Is pretty universal, where they'll take certain parts of the body and attach a number to it. So let's say you have a sunburn on all of your back, the whole front of your body, let's say, interiorly or posteriorly. Those numbers add up pretty quickly, so you could go from a very superficial sunburn to a second degree, maybe even a third degree, due to how many areas are directly affected. So definitely know what the rules of 9 is. Now this chapter kind of talks about what I talked about in the last video with tissues. We talk about cancers. Okay, so of course it focuses directly, think about skin cancers. Melanoma is obviously listed there. That's the malignant tumor. Okay, so definitely they look for the A, B, C, D, and E. Okay, they've added a few more than what I was kind of used to, kind of watching, freckles or nevises, these moles on our skin of what's happening. So the A stands for asymmetry. B stands for whether borders are not even. C stands for the different colors, like the colors are changing. D is the diameter that's more than 6 mm. And then E is kind of the newer one. It's where it's changing, okay, of any of those, of the A, B, C, or D. Okay, so definitely make sure you're always looking at your skin, going to see the dermatologist if there are areas that are changing at that particular region. Now you're going to see skin infections, okay, so bacterias, viruses, fungus, okay, from last video. Okay, so think of bacterial infections coming from like staph, okay, type of infections. Viral infections, think of things like herpes, okay, shingles, okay, even warts can fall under a viral type of infection. And then fungus, the tinnias, okay, the mycotic can be very superficial, also known as tinea. Okay, so we think about that's affecting the epidermis, okay, the superficial layers of the skin. Now we also can have inflammatory diseases, okay, so these would be acute and chronic, okay, think of acute these contact dermatitis, okay, like hives would be an example of an acute, okay, atopic dermatitis, okay, eczema, okay, maybe you suffer unfortunately from that, so you know that one firsthand, like we get a scratch, okay, and it gets irritated. Then it can of course turn into chronic, okay, obviously if it lasts for a long time. So you can have maybe a contact dermatitis, like I got irritated by the soap that I'm using, and then it won't stop and my body just keeps getting irritated by that same thing long term. Okay, that was when it would turn into chronic. Also chronic, we think about you could get blisters underneath the skin, okay, that are constantly there. Anything that's affecting and separating the epidermis from the dermis, okay, that could be getting into inflammation. So remember the ITIS. Other chronic conditions of the integumentary system, you think of lupus, okay, that's that inflammatory autoimmune disease. And then of course eczema can turn into psoriasis, okay, so eczema usually in a lot of books, including this one, kind of put it as more acute, not long-term, but when it goes into long-term chronic, okay, then it could turn into psoriasis, okay, but what makes it a little bit more intense with psoriasis is, again, you get more kind of plaques that develop on the body, usually a lot more thickness, okay, throughout areas of the body. So if we affected the skin, okay, epidermis, dermis, then we're going to affect also the accessory structures. Okay, so acne. Okay, so acne again is a disorder by hyperactivity, overactivity of our sebaceous or oil glands. The other one that we will suffer from, unfortunately, kind of with that, blackheads, okay, that you also can be called of acne, where too much of that sebum is causing that area to get maybe a plug that's in it that's, you know, again, getting infected, okay, so inflammation could occur in that area, those blackheads. And then alopecia also, and of course that's affecting on the hair side. So any type of baldness, either be just a little bit or the whole body is missing hair, that is alopecia. Okay, so the most common type of it we think of, classifies it as male pattern baldness, but obviously it can affect women too. Think of, you know, hair loss itself. But again, with alopecia, it could be, you could be missing eyebrows, you literally not have any hair on your arms. It's classified as kind of an umbrella term for any type of baldness, whether it be a little bit or it be all the body itself. So hopefully within this chapter, you enjoyed watching the different layers of the skin, okay, and then definitely thinking about and understanding how these different glands in our body help with the function of temperature. Okay, so definitely think about and appreciate your sweat glands next time when it's hot outside and you're sweating, okay. The stinky sweat, we think about, you know, as we're growing hair and going through puberty, the importance of those glands. And then definitely think about, of course, oil glands are helping in the job of protecting us from pathogens themselves. So I've looked forward to working with you all today. Manee, you got to do a little bit more and kind of interact a little bit. And I will look forward to seeing you all on next video.